Thanks everyone for coming. I have the privilege of being here today on unceded territory in Canada. And I have the privilege of welcoming and introducing Dr. Pamela Wadende, who is a developmental psychologist and senior lecturer at Kenya's Kisii University, where she teaches and supervises graduate students from East Africa and other parts of the world. And I've been admiring Pamela's work from afar. We're very lucky to have her share some of her ideas with us today. So Pamela's general research interest is in how humans acquire and change behavior across the lifespan. So she generally believes that contextual factors heavily shape developmental outcomes. Successful interventions aimed at improving the human condition should target individuals' contexts and experiences in order to facilitate the behavioral changes such as learning new content or embracing new healthcare practices. She believes that research takes a multidisciplinary approach, yields findings that best represent the perspectives of local populations. Consequently, she's been involved in many projects in the fields of health. Some of these include working with the Pan-African Mental Health Research Network, PAMHRN, to survey the impact of climate change on the mental health and education of the Turkana pastoralist children in rural Kenya. So the determinants of uptake of targeted education content in local populations, very important topics. Conducting culturally grounded mixed methods research to develop a child gratitude scale among the Turkana of Kenya, and Amhara of Ethiopia, supported by TWCF, exploring child language development, and Meal Times in Kenya and Zambia, supported by Global Challenges Research Fund. Other projects she has also conducted include surveying the conceptualizations of human flourishing, its pathway and impediments in rural populations in selected countries in Africa. She belongs to a number of international societies and networks. Currently, she's the incoming International Society for the Study of Behavioural Development, ISSBD, membership secretary for the period of 2026 until 2032. A member of the Global Character Alliance, Pan-African Mental Health Research Network, and the Institute of Integrated Transitions. So thank you for joining us today, Pamela. She'll be talking about meeting families where they are, rural communication that resonates. And welcome.
Yeah, thank you so much, Tanya, for having me and everyone else for having me and for such a kind introduction to this this topic and to me. And for everyone who has joined, thank you so much for honoring us and joining us today. So I'm going to talk about meeting families where they are, specifically how to communicate research findings to families in rural areas of Africa, which I believe has the same characteristics as the rural areas in other parts of the world, other LMIC parts of the world. So in my title slide, there are quite a few logos here. Those logos belong to my colleagues who are, I'm going to draw insight from the studies I conduct with them. So the first one is our ISSBD logo. The second one is our logo at Kisii University in Kenya. The third is University of Bamenda in Cameroon, a colleague of mine. Then we have our funder logo, Templeton World Charity Foundation. Then our own lab logo, Listen to Forgive Lab, and a colleague's logo, a collaborator's logo, University of Gonda. So again, thank you so much for joining us. I would really wish that this webinar become very interactive because we are here to learn. We are also here to learn. We do a lot of research sharing with rural communities, but we can always improve our processes. So because of that, I'm joined, let me see. Oh, I can't move the slide, why? Let me see. Okay, because of that, because we are here to learn, I'm really humbled that I'm joined by quite a number of my lab mates here. I'll just take 1 minute and mention their names. They are here to take notes because from this webinar, we are also going to learn a lot to improve our processes. So on the call, we have Mark Solo, who in our lab is our child protection officer because we work with children. We have Dan Rono in our lab. He's our project manager. He makes sure we do the right thing at the right time, always. Halimo Yusuf is our medical officer. We try also always to have a medical officer in our team. We have research assistants, Lawrence Lebonyol, Simeon, Esibita, Emmanuel. These are research assistants from Turkana. Kevin Kamau is here. Kevin Nganga is our research assistant from Kericho. We have Oscar Lumire is our child talent development officer. Lenny Kiplangat, our data capture officer. And there are many more, I believe, a few more. I might not have mentioned your name, but please, I want you to feel really valued because what you do is what makes us succeed. So thank you so much for joining us and helping us to learn together. So this is basically what my presentation today will be. I'll start with an introduction. Forgive me for starting on the negative side of miscommunication, but I'll gradually build to the positive. What can you do in order not to have miscommunication? Because our presentation today is about communication. What can you do in order not to have this kind of miscommunication later on? Then I'll move on to impediments to good communication in rural communities and some levels of communicating research to these communities that we have identified, and characteristics of rural communities in Africa and other LMICs. And these are the characteristics that really are help us or really show us how we best communicate with these communities. And then, of course, as the title of the presentation says, meeting these families where they are, not trying to remove them and place them in another context, but just meeting them exactly where they are and communicating at that level. Then I'll complete by having a project example of an ongoing project, which is in which we are trying to develop a checklist for gratitude among children in Kenya and Ethiopia. Then we'll just move on to impact lessons and what next, and just some best practices that we hope will resonate with you and other people who do research in rural communities. And then in the last session, question and answer session, we'd really want you to help us with this discussion so that we can also come out of here with more information, more lessons that we can add on to our processes, as I said. Okay. So I'll start off with a few images. The first one is an AI-generated image of an unused library. Power is knowledge, and this is the people's library, according to AI. But the library is locked. Now, although this is an AI-generated picture, I know many of us in LMICs, we have come across such important monuments, such important buildings as a library in a community that is always locked. Both physically and figuratively. So physically, sometimes there isn't a person, there isn't staff to serve people, so it remains locked. Figuratively, it could be locked because the information or the books in there are not accessible to the local community. Maybe it's a farming community and the books in there is talking about computer science. So the library is there with important information which is inaccessible. And this is another AI-generated image of a mosquito net chasing people, and the people are running away, plus the mosquitoes. Now, although this is an AI-generated picture, this is something that many of us are very familiar with. I'll give an example of Kenya. Kenya, 75% of the population 75% of Kenyans live in malaria endemic areas. They are at risk of contracting malaria. According to World Health Organization, in 2024, Kenya accounted for almost 2% of the world's deaths caused by malaria in 2024. And also, according to World Health Organization, in every 1,000 live births in Kenya, 39 or 38 deaths result from malaria. So you can see how malaria is a disease that causes fatalities and how much it should be prevented. But the government is doing something about this. There are bed nets treated with insecticide that many times are given by partners and the government free to people living in malaria endemic areas. These bed nets are free. But the irony of it all is that people are given these bed nets and they don't use them. Many people, some use, not everyone, some use, but many people don't use them. And that is why malaria is still killing people in Kenya in such large numbers. Now, there are reasons for not using these nets. They say the chemical that the bed nets are treated with is poisonous. They say they can't breathe when they sleep under the net. You know, there are various reasons that people give. People say they can't sleep when they are under the net. People say the net strangles them. It's ghost-like. At night, it strangles them. So there is a terribly missed opportunity that results in loss of life when there is something to prevent the loss of life and it is not used. And the next image is the one that is the saddest. Now, what you see here are pit latrines. Now you can see the pits. The way they are, we know they are unused. These white round things, they are pit latrines. I know they are unused. Why? Because they don't have a covering to ensure privacy of the user. So they can't be used. Now the pits are already there. So all the community can do is get a covering which can be even reeds or sticks, that anything that can offer privacy to the user of these pits. But this was not done. Now, this is something that causes a terrible loss of life. Why? Because when human waste is not disposed well, it easily mixes with the drinking water. It gets into the waterways, and we have diseases such as cholera that spread pretty fast, and they have a lot of fatalities coming up. So in such communities, there's always an outbreak of cholera that the government has to fight. So I'll just give an example again of Kenya, whereby between 2022 and 2024, there were 200 deaths out of cholera and around 13,000 people sickened by cholera. Now, I'm giving this with the background that Kenya has one of the strongest health systems in this region of Africa. So this is a strong health system that really tries to suppress this disease, but still it takes 200 people. And cholera is one of the easiest diseases to be cured. Just need some antibiotics. I think antibiotics and if I'm not wrong, antibiotics and hygiene. So with our strong health system, we still try to suppress this, but we still lose 200 people during that time. So this just shows that when people are asked, why is it that we don't use toilets? Because our public health system is also strong enough to go around in community asking people, why don't you use toilets? People give various reasons. They say, some say, we can't use the same toilet. Tradition says that dictates that we can't use the same toilet. A mother-in-law, a daughter-in-law, and a father-in-law cannot use the same toilet. So if there's only one toilet in the community, it means that there are people who, if there's only one toilet in the homestead, it means that there are some people who still have got to use the bushes and not the toilet. So this is also miscommunication. Had the interventionists who brought these pit latrines known that, then they would have even built 2 toilets per homestead to save lives. Okay, so in short, in all the 3 cases I've tried to show, communication seems to have been one way, top down. The interventionist had very, very good reasons and a very, very good plan to sort out a problem in the community. But unfortunately, since they did not seek community perspectives and community voices and community ways of doing things to get advice on how best to bring in the intervention keeps on failing and causing being very expensive in terms of human life, especially in malaria, in the case of malaria and cholera. So let's look at communicating research findings with rural communities. What are some of these impediments that people meet when they try to communicate research with rural communities? The first one is using unsuitable community entry behavior. When interventionists, when researchers first go into a community, they need to be very systematic in unintentional in entering that community. So they need to work with local community gatekeepers. Now, these are people who are trusted and valued and listened to by the community members. For example, elders, mothers groups, and other community groupings. So when these people are not contacted, then chances of the intervention failing are very high. Now, these people also have the community history and values that they can share with the interventionist before they even try the project and the researcher too. Two, data instruments. Researchers using surveys that collect superficial information or translating words instead of concepts in adapted instruments. So for example, researcher using surveys that collect information, for example, in Likert scales. And yet these are communities that have a very old oral tradition, storytelling tradition. They like to explain themselves. They don't just like to answer questions with one word. Then chances of getting good data that you can use for intervention are diminished. Data interpretation. Applying Western frameworks to understand data, for example, prioritizing individual autonomy and abstract reasoning, while African contexts are more communal and governed by traditional structures. So these contexts do not gel with local realities. And then community dissemination, not sustaining contact with the community from the beginning of the study to its end. So having disconnected contact, for example, going in, collecting the data, disappearing and coming back with the findings, then the community cannot feel they own those findings because they don't know how they were interpreted by who, in which way. So it's important to have sustained contact with these communities. Okay, so these are some of the levels of communicating research to rural communities that our team has come up with, and we'll invite any more that the listeners can give. So for example, for the first one being the institutional level. Here, funders and ministry departments set agendas, research agenda and intervention agenda, many times without community input. Look at the case of the insecticide-treated nets. Had they sought community input, had they talked to the community beforehand, maybe it would be different. Look at the case of unused pit latrines. Same. Look at the case of unused library, an inaccessible library. Same. Team level, investigating teams are not adequately trained on culturally sensitive communication. Very important to audit local community values and ways of communicating before trying to collect data from them. Because otherwise you might make some missteps that might cost the whole team the whole study. Then data instrument level, and suitable instruments are used with local communities. And I mentioned about these quick surveys that collect superficial information. So rural communities, many times, since they have a deep and an old oral tradition, it's always good to collect data from them using interviews that elicit stories, elicit explained perspective, they explain themselves, focus group discussions that help people have a conversation. Then at the policy level, policymakers impose Western frameworks that are a mismatch with local reality. I'll give an example of early childhood education, whereby research all over the world has shown how important scaling of early childhood education is for children. But this research comes in, but the real realities on the ground are that they are not enough adequately trained teachers for early childhood education. So although there is a Western framework, there is a mismatch with local reality. And then the whole idea fails because of this mismatch. Okay, so when all this happens, what message do local rural communities receive? They receive the message that your knowledge does not matter, and any one of us who receives such a message stops functioning. We stop contributing, we keep to ourselves, and we let the other person do what they want. And that is sometimes where, as researchers and interventionists, we find ourselves. We are already telling the community without even meaning it that their knowledge does not matter. Okay, let's look at some of these images just to give us a background of what rural communities in Africa look like. What we can see clearly is the community nature. People are together, they come together, they do things together. Children play together. In the first pictures, mothers taking care of children, sitting together. In the second picture, there is old men sitting together. There is always sitting together, discussing together, agreeing together. And that really works well when the researcher also tries to do that. Go into the community, sit together with them, talk together, and agree together. Okay, so these are some of the characteristics of rural communities, some of which we've seen in the images. There is always an oral tradition. People tell stories that carry the community's history, carries the community's values, carry the community's aspirations, and carries the community's fears and hopes. They are gatekeepers. Mentioned earlier on about the importance of these people who are trusted by the community. There is deep belief in the spiritual. So spirituality runs deep. There are so many things that might not make sense objectively, but since it's spiritual, it's too important. There are deep kinship ties in rural communities, deep kinship ties. People live among their relatives, their friends, their community, and there are strong communal values. What this community values as for example, important behavior in the community. Feeding, attending ceremonies, for example, attending funeral ceremonies, child birth ceremonies. Some of these are very strong communal values. And then there's the traditional governance structure, where there are some people who are leaders in the community, not because they are more learned or they are rich, but they're just leaders because traditionally they are the ones who the community have looked at and seen to be the most deserving of leadership. Maybe they are the most trusted, they are the most objective, they are the people who look like they have the community in their heart, the good of the community in their heart. So they are the leaders. So you can't ignore these people if you are a researcher and if you want to talk to this community, because otherwise you'll be talking to the community through people who are not trusted. So you have to make sure you follow the community governance structure. So meeting families where they are. Communication this is a recap, a sustained engagement that begins before the research project is conceptualized and outlives it. So before you conceptualize the research, it's important to have already been forming a relationship with these communities, and it goes beyond the research itself. It's a relational act that builds trust. It's culturally based. There cannot be meaning making without reference to participants' culture. What is their cultural tradition that gives meaning to whatever is being discussed? It's a reciprocal act that requires more than listening and speaking. So here is an example of our project, Listen to Forgive. And here we are developing a scale to measure gratitude and its related virtues. So this is a project that we conducted in 3 sites, 2 in Kenya and 1 in Gonda, with my colleague, Misai Mengstie. I hope he's on the call. And we were supported by Templeton World Charities Foundation. We reached 211 children in the 2 countries. Here is what we set to do. We wanted to develop a scale to measure gratitude among children in home and school settings, gratitude and its related virtues. And we used a culturally grounded mixed methods to develop this scale, then observed their reflection in child behavior in both home and school settings. So we developed the scale and triangulated that what we collected from adults by observing children in home and school settings. So here's what we did. First, we had a very elaborate community entry activities that culminated in a theory of change workshop where we invited leaders and stakeholders in the community who would be interested in child character development. These included teachers, parents, women group leaders, administrative leaders, and any leaders that we had. And we audited and invited. So we started off with qualitative interviews where we did 34 focus group discussions and 27 individual interviews on gratitude. We asked what it was, why it mattered, and how it was taught and appeared or was manifested in children. Then we did the quantitative observation with children. In Kericho, we contacted 84 children, Turkana, 82 children, in Ethiopia, 45 children. So just an excerpt of our qualitative findings. Bringing families, practitioners, and policymakers together on a common agenda. So in school, gratitude is taught through curriculum content and direct instruction stemming from expectations. So these are the findings that brought all these people together in dissemination. But we'll talk about that much more later. So here is an excerpt from a school teacher. What I expect from a thankful child is particular behavior and performance based on school curriculum content. I expect and instruct the child to be friendly to me as a teacher and to classmates. So in teachers, they taught it directly like other curriculum content. We instruct children to show they are grateful by respecting people, helping those in need, and caring for the elderly. So this is also a teacher in Ethiopia. Caregivers and parents, excerpts from them, just 2. Gratitude is primarily taught non-verbally through actions children can observe. So in home settings, from a community member in Ethiopia, children learn gratitude from observation and listening to stories of those acts. For example, in saying, there is a rich man who we hate, but he loves us. There is a poor man whom we love, but he hates us. They learn how to be grateful. So in home settings, children learned non-verbally by observation. In Kenya, here's an adolescent female who says, what shows a child is listening, observing what their parent shows and tells them, is completing an errand or behaving in a way to show gratitude. So those are just very little from the qualitative findings. So now a little bit about the quantitative findings. We originally came up with 5 domains, but we collapsed them into 3. And we are still going to try and make the scale shorter. We are still conducting factor analysis on the data. So in domain 1, we looked at emotional dispositions of a child who is grateful based on what the parents and the community members gave us in qualitative interviews. So they said a child who is grateful is confident, is motivated, is curious, is cheerful, is calm. In the second domain, social behavior, how does this child behave in society? They said a child who is grateful behaves in a respectful manner, is kind, appreciates, is honest, and is generous. And in the broader domain, they say a child who is grateful is spiritual and patriotic, shows responsibility and takes up leadership positions without being asked to. So here is what I'd alluded to about bringing policymakers, practitioners, parents together in a workshop. So this is what we did in our Kericho site. We had the ECD director, the parents, the teachers together in a workshop to discuss first and foremost, to do our data analysis. So we had a data analysis workshop. And then to discuss our findings. You can see a mother giving her perspectives on how gratitude is important and what she does at home to train her children to be grateful, and also advising us about how to improve our scale. Actually, their advice is the reason why we are doing more factor analysis on the scale, because they told us the scale was too long. And the parent told us, one of the parents told us that they needed a scale that did not need writing and reading, because some parents cannot read and write. And the teachers whom we worked with to collect the data told us the scale was long, as I said, and that is why we are working on the scale to shorten it. So it's important to bring all these people together so that we do not try to translate information from one team to another. Let them be in one room, let them talk together. Because if they come from the same community, they can always have a common language that they can use to discuss what they have. For example, in this case, they could all use Kiswahili. All of us in Kenya, Kiswahili is our national language, so most of these people can. And the few who could not, they could always have translators right there in the room. So there wasn't a reason why we would have a parents' workshop separate from a teacher's workshop, separate from the policymakers, ECD directorate workshop. We brought them all together. So it's important to come together in inclusive workshops. So here are some lessons we learned. Teachers, on our scale, teachers and education ministry officials, they judge the scale useful to support the new Kenyan curriculum. And in fact, the policymakers in the room were giving us suggestions on how to pick aspects of that scale and already include it in the content, so that it does not intensify the work of the teachers if they have to have a separate content to teach gratitude. So for example, they gave an example of having stories, poems, and so on that taught gratitude in the English curriculum, and other places in the maths curriculum, in the science curriculum, they gave examples. So it was good to have them in the room together with the others. The parents asked for a home use version of the scale, but they also complained that the scale was too long because they watched how the teachers used it when the teachers and the research assistants we had went into their homes. So personal learnings, it's always important that if you're working in rural communities, you're always learning. Culturally grounded methods need community participation. We affirmed that it needs community participation at every stage, ideally guided by a local expert and supported by external advisors, but built on sustained engagement with participating communities. So for our study, we had local advisors in the form of community members who were knowledgeable in child raising. So we had one in the Turkana site and even in the Kericho site. But we also needed support from people who have developed such skills before. So we had advisors also from high-income countries to also help us in this process, but they were guided by the local experts. But the most important thing that helped us succeed was the sustained engagement with the participating community. Every time we had a milestone, like when we completed the qualitative part of the study, we went back to the community to analyze the data with them and tell them what we got and hear what they thought about our process. Then our next step, I alluded to, we are going to do further factor analysis to make the scale shorter so that it's easier for the teachers to use. And then later on, develop a parent-facing version for use in home settings. So in engaging, in engaging study communities, we learned from our processes and from our study is that it's important to initiate a relationship way before research. So for example, in the Turkana community, the study that I'm talking about started in 2024 and ended, is just ending, but we started relating with this community on other projects in 2021. In Amhara, Gonda, we started engaging the community in 2022. Yes. So the relationship should begin before then. And many times it's even good to understand the community's priorities and build it into your next grant proposal that you're writing. Conduct elaborate community entry activities. Community members, as I've alluded, should at least be able to contribute to the agenda. And this can only happen if you initiate the relationship way before you start the research, even way before you write the proposal. We used active listening as a method, and every time we tried to refer to the community at every milestone so that they can tell us what was going on, and if they thought our processes were still on point and if they were still useful to them. And we aligned our activity to local community structures. We did not try to use any other structure. So the community among the Turkana, the chief, administrative chief, is a very trusted and respected member of the community. So although he's not in education, we had to work with him because he's a very important gatekeeper in the community. Not so in Kericho. In Kericho, we worked with the ECD directorate and other gatekeepers. We trained the research team on culturally sensitive research methods, and this was easy for us because we try as much as possible to work with the local teachers and work with local research assistants who understand the language and the language and the culture of the community, so that they can help us. They can help us understand when we are not being sensitive to community values. So we rely on this guidance. So it's important to work with local people. And lastly, endeavor to gather community members, practitioners, policy makers, and researchers under one roof for every milestone discussion. This really served us well, so that we didn't have to try and interpret information from one group to another. They were all in the same group, they were all in the same room, and we were making the discussion together, and they would give their perspectives for each other to listen to. And that was so important for the policymakers, because they would, sometimes policymakers are government workers who are sent to a certain place to work. They are sent to a certain place to work that is not their ancestral home, so they don't know as much of the culture of that area. But bringing them together in these workshops was important because they could also learn about the culture of the area and the needs of the local community. And the local community would also understand what the policymaker was talking about because they were under one roof. And also this dispelled mistrust where maybe community members would think the policymakers, those are from the government, they maybe have nothing to do with us. But if they come together, it dispels the mistrust because now they are a community. They are a community working together. Okay, so it's important, as I conclude, it's important to note that involving policymakers early matter. It's important to translate research for impact, speak the language of policymakers to ensure research translates into action. So make it simple, make them part of the discussion, and your research can translate into action. Practitioners are partners. Teachers, if you're working with children in school, teachers are your partners. Do not collect data without involving the teachers, because at the end of the day, we would want the teachers to use the scale of gratitude that we are developing in their practice. If we collect the data with them, it makes it easier for them to take this scale, accept this scale and use it. But if we collect data without them, if we work without them, then the scale is new to them. So practitioners, please always treat them as partners. Ongoing consent. Moving from one-time signature to continuous dialogue of trust. Actually, many times in rural communities, you don't even do a signature. It's a dialogue of trust. So it's a continuous dialogue of trust. Participants are partners. That is why it's important to have them in the same room during dissemination and during data analysis workshops and so on, because they are also partners. They are also users of this information that is being gathered. And then this is just a snapshot. As I complete a snapshot of our investigating team, we had research assistants, we had child protection officer, Oscar Lumire, we had child protection officer is Maxwell Olo, talent development officer, Oscar Lumire, we had the elder, the chief, we had university student, Raymond, we had parents and caregivers, we had a health officer, Halimo Yusuf, NGO partners, Maxwell is also an NGO partners, policy makers, we had the ECD directorate office join us. So it's important to have a very comprehensive research investigation team. I really do know, and I'm aware that sometimes the funds might not allow you to do this, but you try as much as possible, if possible, to have these people as part of your team. Sometimes the people come in as volunteers, sometimes they come in to work and then you have to pay them, but try as much as possible. So thank you so much for listening to me. These are just some of the references that I used in this in this discussion. Thank you so much for listening to me.
Thank you very much for that outstanding talk. I don't know if you'd like me to facilitate, Patrick, or are you, Pamela, okay to take questions from the audience?
Yeah, it's okay. I can take questions. My team members are all here. So I'm really happy to be here.
And there are a couple of questions, Tanya, on the chats. Perhaps you could begin with the ones on the chats. Yeah. There's one by ETA, which is looking at, could you explain the process of including community members in qualitative data analysis, which could perhaps be combined with Stevens, which is looking at shedding light on how we can involve communities during research design stage and objective formulation.
Okay, so maybe I'll start off with Stevens and move on to ETA. So community members, including them in the research design, is when you start the relationship with this community way before you even write the proposal. In that you get the community and see their lived reality. What is the issues they have? What do they want help with? And then from there, you can now bring this into some of your objectives. I'll give an example. For example, the first time we went into the Kericho community in 2019, we had a small pilot grant by New York University. And when we went into that community, the teachers in the schools, the head teacher told us, we really want, if you're coming to do research here, we really want you to train our teachers to do action research so that they can work in the community, get insight about how children are motivated in the community, what practical ways they can bring into the classroom to help the children transition easier from home to school. And since this was not going to cost us any money, we are in the school anyway, it wasn't going to cost us anything, we decided to do that. And we gave a workshop of 5 days. Apart from our inception workshop, we had topics on basic research. So the community, the school community got that from us by, Americans say piggyback. They piggybacked that on our work and it didn't cost us anything. So I think getting into the community early, finding out what is their issues, then as you write the research, as you write your proposal, you include that. Or even if you have not done that, as you launch your study, always give a leeway. What else do you think we can help with? It is a very kind, I think it's a very gracious way of telling them we are together. What do you think we can help with? Some will tell you, when we went to our community in Turkana, they'll tell you, employ our young people to be your data collectors. What's wrong with that? That's excellent because they speak the language and they are learned, they speak English. So we have Simon Esibita here. It's one of our research assistants in the Turkana, and they do an excellent job because we train them and they speak the language and English, and it make our life easy. So basically, that's what I would say about that. Yes, Suman.
Yeah. Pam, thank you so much for sharing this work, which was so exhaustive and intensive. I was wondering, what kind of barriers did you kind of face? Because even when you're talking of all these levels in the community, different people, stakeholders, so what kind of challenges were there and how did you resolve them? I mean,
So first and foremost, the challenge is language. Lawrence is here, Simon and the rest. They'll tell you, I don't speak a word. I speak very little Turkana. Maybe I can only greet people in Turkana. I speak very little Turkana. So that's one language barrier. But then that one you sort out by getting research assistants from the local community. And then they present you to the chief, and that one is sorted. Another one is culture. That one is also sorted the same way. I don't know what this behavior means among the Turkana, among the Kipsigis, because I myself am a Luo. So that one is sorted the same way. Kipsigis, I'll talk to Dan. I think Daniel Rono is here. I talk to him, how do I behave when I meet an old man who I want to talk to about this sensitive topic? He will guide me. So I think relying so much on local research assistance is very, very important. I believe my colleague Henriette Zilda is also here. We also have a project in Nanyuki. We also there work with local research assistants because we are not able to, we would step on toes if we try to navigate the culture and things like that. We have got to be told. And you try to, bring yourself to be a student. A researcher is always a student. Bring yourself to be a student of the community. So those are some of the things, challenges that we had and how we went about them.
thank you.
Ebo, I think Ebo has his hand up.
Thank you, Pamela, for such an insightful. Yes, I'm here. Can you hear
Yes.
me?
Yes.
Hello, can you?
Yeah, we can hear you.
Okay. Thank you so much, Pamela. It is such an insightful presentation for me, because I intend, or in my work, I'm trying to work with local communities. However, I'm wondering, in situations where you are doing your work or validating your instrument or something like that, for the local context, and they say they want a qualitative, or as in a more narrative way of going around things. In that case, you have to adjust your instruments, I guess. How does that affect your reporting approach, or maybe quantitative analysis, or analysis that you would want to do? Do you then switch to qualitative validation approach, or how do you go around those things? I hope I am clear.
Yeah, that's an important question, because even us in our project, we had both qualitative data and quantitative data. So qualitative data is when we were looking at conceptualizations and understandings of gratitude. How do parents conceptualize gratitude? How did these adolescents do that? Now, in that case, you need a story. You need to collect stories. But when we are observing the children, since it was objective observation, then that now is quantitative. So that one now you don't turn it into qualitative. Just observe and you use your checklist. So it's still possible to collect quantitative data with rural communities, but just know what is it do you want. If you want conceptualizations, you want the whole story first. You just don't want the one-word answer. But then when you're objectively observing the children, then fine, you can have the one-word answer, no problem. Famida Tofile.
Thank you, Pam. It's a very nice presentation. So maybe I'm asking a very silly question, but this is what we face whenever we go to a community. So they ask that why you are asking us this question and how it will help us. So this type of question we face. So how you convince them to participate and also to give their thoughts by saying what? I mean, what story you told them to bring into the topic? Over. Thank you.
That is an excellent question. Thank you so much, Famida. Yes, it's really a challenging question, because why are you asking me this question? How is it important to me? Why are you asking me why I'm not sleeping under a mosquito net? Why is it important to me? Now I have my story. Mosquitoes are very dangerous. They will kill children in the community. And then if I have some data I can quote of how many people died, why, sometimes when people have malaria, they don't even know they have malaria if the doctors don't tell them, like they have a headache, they have a cold, and so on. So tell them, sometimes when you feel like that is malaria and it is very dangerous. You explain, it is important to you. Okay.
Right.
Why is gratitude important? There's another example I would give. Why is gratitude important to me? Why should I know about gratitude? Then you tell them how supportive gratitude is for children and people who live in adversity. Because if you have a grateful outlook on things, then you survive better when you meet adversity than if you do not. So, you just have got to calm down and try to explain in those ways.
Right.
Okay.
Thank you. Very helpful.
Mohammed Abdullahi.
Thank you so much for the insightful presentation. I'm just wondering, so there is a slide talking about local gatekeepers. So what if the local gatekeepers don't want to show the actual picture? Let's say they are ignoring or marginalizing the youth or women. What is the process that we will navigate through this barrier? I want to know, because in LMICs, like I'm from Bangladesh, I can see there in our societal context, there are a lot of cases where male dominant feature can be seen. So in this context, this question arose in my head. That is it.
Thank you very much. Yeah, that would really be a challenge and an impediment to moving from one point to another. Because if this is the person who you think is the gatekeeper and is the one who has a problem, then I think maybe you need to look elsewhere. There are some people in the community, they are very strong. Maybe they are rich, they are powerful, but they don't have the community at heart. I don't consider those ones gatekeepers. Because like a dominant male who maybe dominates and wants, behaving in maybe suppressing the female voice and so on. Yeah, they are strong, but I don't think they're gatekeepers. A gatekeeper, in my understanding, is somebody, they don't have to be the most learned, they don't have to be the richest, they don't have to be the strongest, but they just have to be the person the community trusts. The person people trust. For example, you can go ahead and ask, who do you go to when you have this problem? Then you'll now get pointers to who real gatekeepers are. Because sometimes when you have a problem like somebody, there is stress in the community, maybe, who do they go to? Many times they don't even go to the richest person because the richest person might be arrogant. They could go to somebody else. Now that really is the gatekeeper. So maybe just auditing well your gatekeepers. Who are these people who have the community's interest at heart? Then now those are the people you work with. Yeah. I don't know who was next. Patrick. I'm not sure who was
Perhaps
next.
you could take one more question because we have 2 minutes left. There's Nahian and Samson.
Okay, Samson and
who's
then Nahian.
there?
Yeah,
then because we have 2 minutes.
Thanks, Pamela. Can you hear me?
Yes.
Okay, so I know that there's not much time left, but I wanted to ask you, thanks for the presentation, but how do we bridge the culture at home and the culture at school? Also, like the culture or even language for development and language for our communities. Because most of the times when we are teaching students, we are doing like exotic or foreign things. You are bringing the malaria issue, it's like a very foreign thing. So how do we resolve this and make development or even education so contextual, so cultural, and so local? Thank you.
Yeah. I think putting the practitioners, policymakers, and researchers under one roof will help bridge this, because everyone listens to the other in real time, not one story being carried over to the other side. So you bring the teachers with the parents, then they'll understand how the parents think. They bring the parents with the ECD directorate, they'll understand how these people think. And then your big team of research, like the talent development officer we have, and so on. So I think maybe bringing people together. I'll listen to Naya, maybe.
Yes, thank you for your presentation, nice presentation. I would like to ask, do you think your culturally grounded framework for measuring gratitude and positive character development would be adapted for like LMC countries like Bangladeshi children? And what would be the first step if we want to apply it in our countries?
It can be adapted to LMICs, but it has to be translated conceptually. Has to have a conceptual translation, and then you pilot it and you see what works, what does not work, and then you add on to that tool. So it's possible to use it when it's done. Patrick, I know you said only 2 questions, but I have my colleague here, please, from Kisii University. Just one sentence question, and then maybe before you go, Oyaro, please.
Thank you, Doc, for such a nice presentation. Just a simple and quick concern. I understand that to some extent, the researchers don't come from those rural areas. So how do you ensure there is a follow-up and actionability of the findings?
How do I ensure what? There is what?
The follow-up and the actionability of the findings.
Yes.
Yes, Doc. Yeah.
Yes, you do sustained engagement, sustained. So I'm not done with the Turkana yet. One project ends, another one begins. I'm not done with them. And then, you try to keep to that community, work with them, even if you try to share work from one community to another, but at least you sustain sustain contact with a certain community. That will help you know that. Yeah.
Thank you, Doc.
Okay, I think maybe we should end it here since we're out of time. But thank you so much, Pamela, and thank you everyone for joining us. And we look forward to seeing you next time. I don't know who is on the lineup. Patrick, I don't know if you have that at your fingertips.
Thank you so much. Yeah, so the next webinar is gonna be in August, August 20th. It's gonna be a webinar by Dr. Jennifer Lansford. I'll be sharing the registration link with you all via your emails. And we look forward to also sharing the recording as well, which is also made available on the ISSBD YouTube channel. So yeah, thank you so much, Dr. Pam and Tanya, for coordinating this as well.
Thank you for the love. Thank you so much.
Kwaheri.
Kwaheri.
Bye.